Hello viewers, we hope you are doing great. In our previous video, we have covered excessive sweating and especially primary excessive sweating in detail. Today in this video, we'll discuss in detail secondary excessive sweating. This type of hyperhidrosis may mark for some deadly disease and should be taken seriously. We already know that sweating is our body's normal procedure to cope with some special conditions. But excessive sweating or hyperhidrosis can be a warning sign of thyroid problems, diabetes, and many other kind of infections. Excessive sweating is relatively more common in people who are overweight or have some medical conditions. It can be upsetting to have sweat dripping from your face and palms or to have smelly feet and shoes. Patients of hyperhidrosis are forced to limit their social life. They are supposed to avoid outings and gatherings. Dear viewers, let's learn the second type of excessive sweating, which is generalized sweating or secondary general hyperhidrosis. Secondary hyperhidrosis has its onset during adulthood. Unlike primary hyperhidrosis, secondary hyperhidrosis is typically caused by any other underlying medical problem or some medications. That's why we call it secondary, as it is just a consequence of some other actual problem. In secondary hyperhidrosis, sweating may occur in large areas of the body parts. Its symptoms also tends to occur during sleeping. Causes of secondary hyperhidrosis. There are many possibilities including different medical conditions, for example, diabetes, cancers of different types, excessive use of alcohol, thyroid problems, that is hyperthyroidism, different types of severe heart, liver and lung disease, rheumatoid arthritis, stroke, many hormonal problems, spinal cord injuries, infectious disease, example TB, tuberculosis of HIV. What is anxiety? People who have any kind of anxiety disorder may experience more frequent sweating than others. Medications for anxiety can also cause general excessive sweating. Treatment. Although the cure directed to hyperhidrosis is not as popular in practice, ways are usually adopted to control the symptoms. They include maintaining hygiene. People suffering from hyperhidrosis should take extra care of their hygiene. They must wear shoes and socks made from natural material. Shoes should be put off when not needed to let the feet breathe. Socks should be changed frequently to avoid the smell and bacterial growth in a moist environment of sweat. Antiperspirants. These days we have over-the-counter or prescription sprays containing aluminum chloride and lotion to be applied topically to control symptoms. Antiperspirants are usually advised for mild cases of hyperhidrosis. Hyperhydrosis. In this treatment, low-level electrical currents are made to pass through the hyperactive areas in our skin, which will temporarily inactive the sweat glands and will provide good symptomatic relief. Botox. Injections of Botox, botulinum toxin, can temporarily stop the nerves from triggering excessive sweating. It has been approved as a safe treatment for excessive underarm sweating. Botox is also used to treat the wrinkles on our faces. Medications. In severe cases, we go for drug therapy. Some drugs can completely stop or slow down sweat production by sweat glands to an optimum level. The FDA has recently approved a newer drug, Qbrexza, glycopyrronium, as a safe topical drug after its clinical trials for primary axillary hyperhidrosis, particularly excessive underarm sweating. Many other drugs are still under clinical trials. Surgery. The last resort for the treatment of patients with hyperhidrosis should be surgery. One method is cut the nerve in the chest area that triggers excessive sweating. Another is to remove the hyperactive sweat glands surgically. So, we have covered a handsome details of excessive sweating. Now we have the idea of two types of hyperhidrosis, their causes and treatment. Please let us know in the comment section how this video was helpful for you. Pass this information to others.